Hello and thanks for joining us on this morning. Let's apologize for coming to you 15 minutes late. One can really predict the traffic situation in Lagos, and that's why we're coming late. Again, we apologize. We're still focusing on COVID-19 pandemic in the country. Different controversy arising from it. There are issues around the vaccines. There are issues around whether we should have a second lockdown. There are issues of people not following the guidelines for staying safe. There also, now the biggest issue is whether schools should resume. Now, the earlier resumption date for resumption for schools was supposed to be 18th. Now, the federal government, ASU, are all saying, well, that is still being considered when you look at the fact that we're having increased numbers of cases in the country. The highest being about 1,664 confirmed cases. And so that is raising concerns, especially also with the new variant. And so those are some of the issues we are going to be looking at today. School resumption delayed school resumption as a result of the COVID-19. We have our first guest with us, Dr. Omadele Boyo, who is a public health expert. Good to have you join us, Dr. Omadele Boyo.
Yeah, thank you.
So many controversies. Let me just start by looking at the fact that we're having a lot of issues with the COVID-19. People are not following guidelines. We're having high rates of fatality. Just yesterday, we had 12 fatalities, which is the highest daily fatality. When you look at how we have been handling this coronavirus, what is your biggest concern?
Yeah, my biggest concern is getting people to buy in. There's a lot of conspiracy theories out there, and people don't just believe that this disease is as dreadful as doctors and other health practitioners are saying. Most people believe that, well, it's a big man's disease or it's not as terrible as we're saying. So there's a need to get people to change their knowledge, their attitude, and their practice. So if people can change, and the only way to do that is for us to show them by example, be more transparent, let them even see what's happening. Let them see that the deaths are real and the numbers of those infected are real. So, and that's the challenge we have, getting people to buy in and believe this thing. And you know, when things change from numbers and you begin to have names attached to numbers, close at home, people will understand what it's like. But they just see on television, 12 dead, and it's like, really? So we need to convince the populace. That's where we are now.
Especially for TVC, we've been to isolation centers a number of times. Yeah. We've spoken to people who are recovering and those who have recovered from coronavirus. Yes. And yet people tell you that, look, this is, in the word, is calm. Do you think that this is really about awareness, or this is just some level of trust deficit between people and government?
Oh, big time is trust deficit. That's the first thing. Because people don't trust the government, they don't trust the politicians. And so whenever they talk, it's more like, oh, there they go again. So we need to get people, and you can only build trust if those in authority are consistent and they are making people to realize that these things are real and they are coming. Like now, at times you don't wonder what can the president address the nation on this issue? Governors are doing that every day, but people just feel that it's not real. And it starts from the breakdown in trust between the politicians and the populace. That's where it starts from. And so to do that, we need to consistently tell them. TVC may show all the pictures that you can think of, but the politicians, those in authority, policymakers, have to engage with the people from the grassroots up. Engage with them, hear what they are saying, show pictures. I mean, people watch television these days. Some of them don't even have power. So it's like going back to the town crier, going back to the level of the average person on the street to know that this thing is true, and saying it over and over again.
All right, so let's look at the biggest issue. I mean, there's no doubt that COVID-19 has affected every area of our lives. The aviation sector is still reeling from the impact of this virus. And our schools are also being affected. Initially, they were closed, and then they were reopened, and now closed again. And the federal government is saying 18th of January might not be a feasible date. Talk to us about how opening of schools will impact on the spread of this virus. Is there any correlation? Because we're getting new messages messages from UNICEF. Is there any correlation between whether these schools will impact on the numbers that we're having now in terms of confirmed cases?
Yeah, on surface value, you can't see a clear-cut correlation. People are going to market. Markets are opened, malls are opened, and people are moved. Bus stops are packed full, and people are besieging the National Identity Management Centers for NIN, and people see all the crowds. So you just wonder that, look, children are less likely to transfer this virus. So why are we doing this, you know? But that's not the case. The case here is that when you open schools, especially universities, but I'm sure you're talking about primary and secondary schools, when you open schools, a lot of things come in. Teachers. Most teachers are above the age of 25, 30, and they may have pre-existing conditions, and children could be carriers. They may not even show it, but they may be positive. And all the teachers may not be the carriers. And then when schools resume, there is interaction between parents, teachers, children, the security man, the sweet seller at the gate of the school, then the admin staff of the school. So opening a school is beyond learning. There's a lot of other ancillary activities that take place in schools. So the government is really worried. And the other thing there is enforcing things. Now, if we say people should not wear face masks, it's difficult to enforce because the security people are not on duty. The police stations have been burnt, and most policemen enjoy arresting people when there's a police station to take them to. Now, there are no police stations to take them to. You take them to Area F or somewhere, and look at all the crisis. So we don't have, if you go on the streets of Lagos today, you don't have policemen the way you used to have them because of the NSAS riots. So the government is thinking between a rock and a hard place. If we do total lockdown, how do we enforce it? If there's a curfew, how do we enforce it? So these are the issues. So picking the school is more like picking a soft target. This is one we can control. If you say people should not go to market and you want to close down the markets, how will you enforce that? There'll be a riot. So I agree with you on the face value. The schools are not, they don't look like mega spreaders. But the truth is, opening a school involves more people entering the bikes to school, teachers coming to school with their own challenges of age, comorbidities, and things like that.
But UNICEF is saying that the schools are the safest place to reopen. That if at all, when there is a lockdown, the first place to reopen are schools because you have less likely number of cases in those environments compared to when you have the marketplace, the malls, like you just mentioned. Would you agree with that assertion from UNICEF?
Yes, I agree with it because all over the world, schools are opened with a lot of caution. For instance, you want to make sure all teachers are tested, which is easy to do. Like if you want to travel out now, you do a test here, you do a test when you get to the country that you are going to. If all teachers can get tested and those that are negative can come to school, because there's no point testing all the children. Test the teachers, test the gate men, test the security people, test the admin people, then we can move from there. So it's can we do that safely? Can the government get the school teachers to have free tests? If they're going to have free tests, the average test here is about 50,400. Some labs say 400,000. Can we get that done? So if you're going to open schools, and that's what UNICEF is saying, there are guidelines to opening of schools. And we must follow those guidelines. Now the question is, how many schools are in Lagos? How many teachers are in these schools? And can we adequately test all these teachers? So sometimes the government won't come out straight and tell you all these issues, but they just say don't open schools. But when you push further, you find that there's more to it than meets the eye. How do you get teachers tested? If you say every school should test, the admin people should test, not just for the children's sake. Other teachers will interact with their fellow teachers in the staff room, on the corridor, and if a teacher is a spreader, they're going to take it home. So people should know that you can be COVID positive without symptoms. And when the teachers come to school, you just do the temperature check. wash your hands. If the person is COVID positive without temperature.
But Dr. Boyo, doesn't this speak of how we are handling this pandemic? Because we've shut schools before, and we had ample time to put a lot of things in place. And it looks like we haven't put anything in place. If we're having to shut schools a second time, and government is saying, look, go home, there is no provision for homeschooling, there is just no provision for anything in most of these schools. Doesn't that speak of how we're handling this pandemic?
And that's why there's trust deficit. If you think these things are dangerous, what have you put in place to prevent? I'll give you an example. In many countries of the world, even in Nigeria here, just keeping children at home has its own issues too. Many children are abused at home. Many of them, I mean, even the online schooling, difficult to monitor with parents going to the market and leaving children alone at home. Data, lights, to power the various handsets or devices they may use. So telling children to stay at home without making the home environment conducive for learning, and without monitoring it. Other countries of the world, you will find that you don't just give online. There's online teaching is a whole dynamic on its own that is monitored, and you go on the tablet or whatever the children go on, they are prevented from checking other dangerous websites like porn websites and things like that. So they need to be supervised. Doing online doesn't mean you are abandoned to your fate. There must be supervision. And these teachers ought to call parents, find out how they are doing, and there must be feedback between the school and the children on how they are doing. But when we tell children to go home, without all these backups, they were also punishing them the other way around. If you in Japan, there were studies that showed that Japanese people during the shutdown began to commit suicide, just staying at home. There have been mental health researches that have shown a lot of people, being depressed, just staying at home. So we must look at it holistically. If we're going to open schools, put structures in place for the schools to be open, make the COVID tests heavily subsidized, if not free, so that like NIMA in Lagos here and many other state government outlets, laboratories, do the test free of charge. Then let teachers get to do the test. Now, if you say teachers should do the test, what about the frontline health workers? In most countries of the world, they do the COVID test every other week. So that because they themselves could be spreaders. Because if a health worker is positive and coming to work, it can give it to the person who is even negative. So testing, tracing, and treatment. Now, if the testing is not being done, we're exposing people to more hardship and more havoc.
So the biggest challenge or the biggest worry is not even the high-end private schools, because they have their way around, the money is there, but the worry is mostly for the public schools and then the low-income private schools. We had a time where we said, look, everyone, there is an enforcement, the government is coming around to check the schools, how prepared are you? So if they were prepared then to open, and they're prepared now to open?
The point is that we've not been able to analyze how prepared they were then, because the rules included the fact that they were expected to have physical distancing in the classes. And the worst place to think of physical distancing is public schools. There are classrooms with 60 people in the classrooms, and the desks, no physical distancing. The only way you can do physical distancing in classes is to have evening school or 3 days a week school, so that all the children don't go to school one day. I don't know why you're getting me. In a class of 60, if they do 20/20, Monday, Wednesday, and Friday, it could be easier. But then you have a curriculum to complete. Then beyond that is that children are not the kinds of adults that you can tell don't shake, don't hug, don't talk close to each other. Children don't know what social physical distancing is. Once they come out of class during break, during lunch hour, they are going to hug, they are going to hold themselves, they are going to laugh together. And these are the things the government is trying to prevent. Because if you say schools should reopen, you can manage adults. And so when you get to church or when you get to an office, stay 6 feet apart. If you keep children 6 feet apart in a classroom, turn your eyes away. They've gone close to each other again. So these are the issues, and these are very young people that you can't really enforce more of these rules. So the government ought to come out straight and tell us what their fears are, and then tell us that, look, in the next 3 months, we're going to do 1, 2, 3, 4, 5, and so we should be able to open because all teachers will have COVID tests done every month. The children coming to school will be giving face masks free of charge, for instance, and then they will learn how to keep this. Maybe you say primary, what do they call it now? Basic school. Maybe you can say like what we call primary 4, 5, 6, or before. Let's allow those ones to come because they're older, they're more, they can take instructions, you know. Then you can say secondary school GSS 1 to 2 or 3, or GSS 3 and SS3. But you see, these things need a lot of logistics, a lot of planning to go into it, and you must be ready to spend money.
But do you think that that's the problem? Because it looks like, look, we just do things by default. So everybody go home, but nothing is done in the interim. And then when we have, you know, less number of confirmed cases, go back to school. We have high number of cases, you know, don't go to school. But there is nothing really being done in the interim to ensure that all of this the impact of this coronavirus is mitigated across sectors. If
you ask the government, they'll tell you they are doing something. But the point is that we don't see any semblance of something going on in the interim. Because frankly speaking, statistics will tell you the number of children that are in school, the number of children in a class. I mean, a class ideally should not be more than 25, but we know that most classes are beyond 40. And then what strategies are in place? And this is what we talk about trust deficit. If the parents and the teachers see that you're not putting any strategy in place, like what you're saying, there are no studies done, and there are no parent-teacher engagement, teacher and state university board, state school board engagement. There should be these things where we hold a town hall meeting where people are properly kitted and then we can talk. Or we go online on a Zoom. And then people will now come up online to tell them what you have put in place. Then parents will be willing to say, look, we are planning to put these things in place between the month of January. By February 1st, you'll be able to go to school because these things are already in place. Every day there's a delivery of 1,000 face masks. Every day, every week, teachers are going to be tested. Or every fortnight or once a month, teachers will be tested. So we're going to do that and get this thing ready. Look, we're talking about vaccines. But how many tests are we doing? How many people are being tested every day? We're not able to test people. Now, the various laboratories in town are charging 50,000 for who can pay that every month? How much do teachers earn? And you find that people only do those tests when they want to travel? Oh, when they have symptoms, not when they want to travel. Yeah, when they want to travel, when they have symptoms, that's when they go for the test. But the problem with COVID is the healthy-looking carrier without temperature, without cough, but is carrying this thing. And those are the spreaders in parties. Nobody will go to a party with temperature. How will you go to a party with temperature, lack of appetite, lack of taste, lack of smell? You want to go to a party? You will not go to a party. So most people that go to parties are healthy carriers who now infect people with pre-existing morbidities. So young people, and that's the problem we have in this country, is the demographics. 70% of the population of this country is below 30. And in most cities, in most states, is 2% of the population are above 65. But these are the most vulnerable people. So people that are below 60 who have coexisting morbidities like hypertension, diabetes, even asthma, they will go, they'll be the first to die. So people that are moving around the streets without all this comorbidity, and don't forget, we don't even know whether they have because we don't use the hospitals. Most people don't know their blood pressure. When you say 1 in 4 Nigerians are hypertensive, that is enough to let you know that there are people waiting to be infected and die. So going back to what you said, the government should build trust by telling us what they are planning to do if the schools remain shut. Explain to us why you want to keep the schools shut and the structures you want to put in place in the next 2 weeks, 1 month. So if you say by February 15, schools will open, this is our plan. By February 15, every teacher will have access to test once a month. Children that need to be tested will be tested because children can have COVID. Then we are going to say all ancillary staff, security, admin, and everybody will get tested before they come back to school. So this is a very worrisome challenge for the country because we do not know when we're going to recover from all of these breaks we have had in the education sector. And we're also having more out-of-school children. Yeah.
We're having, especially in the northern part of the country, now a lot of people who are not in school will find it as an opportunity to relax and stay back at home, especially when you don't have that strong parental control. So for you, what is the best way to reopen schools, and when is ideal to reopen schools?
The best thing to do is to first go with the universal primary education program, the universal basic education program, that all children above the age of 6 must be in school. Any child who is not in school, the parents will be taken to court. Children who are hawking, any child between 6 and 16 should either be in primary school or in high school. And if you are caught on the street during school hours, you'll be arrested. Not arrested, you'll be thrown to jail, but you'll be arrested and your parents will be asked, and it's not right for you to be on. Once you know that Monday to Friday, 8 a.m. to 2 p.m., nobody below the age of 16 is on the street. That's the beginning. Now, when people know that, they know that we are serious. Then 2, provide the schools. It's one thing to say children should be in schools. It's another thing for the schools to be available, conducive, accessible, and affordable. So if you have schools that people will have to trek from maybe Oshodi, or Lagos is tight, so you can live it like that. When you have to trek 3 miles to go to school, children won't go to school. It's too long. Then if you have schools where you don't have lunch, in Europe and America, there's provision for school meals, free of charge. These are incentives for children to come to school. So if we're going to do that, I mean, if you have the chance of entering a school in Europe and America, you want to go to school. It's just like going to a hotel. Everything is so beautiful and attractive. How do you want children to be in school when you can see people sitting under a tree to read? How do you want children to be in school when the chairs are broken? At times you have to buy your own table to come to school. How do you want children to be in school when the books are not provided? So there's a level of poverty that is detrimental to the educational sector. Now schools are free, but the things you need to have to go to school can be beyond your pocket. So if we're going to do that, we have to re-examine the whole educational system, re-examine facilities, and make sure that these things are not only available, they're accessible, they're affordable, and they're exciting to go to. So children will be missing school because it's fun to go to school.
Absolutely. We'll continue to see how the decisions that the federal government will reach in the coming days, especially as it has to do with the resumption of schools. Dr. Omadele Boyo, public health expert, thanks for talking to us.
Thank you very much.
All right, now let's take a quick break. When this morning returns, we'll continue to look at the resumption of schools now with the universities. We'll be talking to the chairman of ASU Unilag chapter. Stay with us. And thanks for staying with this TVC News. You're still watching This Morning. I was staying on the controversy surrounding resumption of schools as a result of the COVID-19 pandemic. Joining me now is Dr. Dele Ashiru, the chairman of ASU Unilag chapter. Good to have you join us, Dr. Ashiru. Now, talk to us about what your concerns are, because we know that ASU continues to raise concerns about resumption of schools, especially when it has to do with the state of our universities.
Well, the concerns are not different from the general concerns in terms of the non-pharmaceutical aspect of the COVID-19 protocol. In a university like the University of Lagos, where you have well over 17,000 students across board, and government has not really been forthcoming in terms of providing the necessary infrastructure, the necessary reorganization that would allow, a seamless resumption of students. Typically, a LAG class in Unilag takes over 1,000 students. And if you have 1,000 students from different social, economic background, coming together in an enclosed space, what that portends is the spread of the coronavirus. Not only that, the classrooms and the hostels where students stay also accommodates, a very large number of our students. And therefore, we're worried that if we have to physically bring back these students from all across the country, it will certainly create a lot of challenges, both for the university administration and for the students, and by extension, the Nigerian society.
So as we speak, the number of students in the university, whether it's UNILAG or UNIBEN or other federal universities, will not change. So if you have 1,000 students in a class, they are not going to reduce. It's 1,000 students. And it will take time for infrastructure to be improved on. It's going to take a year or less for government to say, let's have more classes, let's build more hostels. So are we saying that unless these things are put in place, that schools are not going to resume?
No, that's not what we are saying. What we are saying is this pandemic should be a wake-up call to those agencies in charge, government agencies in charge of education. When you prepare for the rainy days, when it's raining, you are happy. But if you have a leaking roof and you are ill-prepared for heavy rains, when it comes, you know how it feels. So what we are saying is we don't have to wait until there's a pandemic for us to begin to do what we should do just like a routine. Take, for example, if government had commenced expansion of infrastructure in the university to cope with the increase in the number of intakes of students, by now we won't be complaining. If there had been superb state-of-the-art, digital learning facilities, quite easily learning would have shifted to online and digital and other alternative platforms. So what we are saying is government should seize the opportunity of this pandemic to take more than a passing interest in the education sector because of its importance. Those who are successfully confronting COVID and manufacturing vaccines and doing all what they are doing in more serious societies are able to do so because the level of educational development, their education system is highly sophisticated. So that's our desire for Nigeria. That now that we have seen situations like this, you never can predict what kind of mutation or another variant similar to coronavirus may erupt. Maybe not this year, maybe sometime in future. So we are saying that, like our union had been clamoring over the years, take interest in the education sector.
And absolutely, Dr. Shure, a lot of people will agree with you, but when you also look at this pandemic across several countries, we've seen how universities are also taking the lead. For example, at the heart of research in the United States is the Johns Hopkins University. We've not seen the academic institution rising to the challenge in the country in terms of research and innovation.
That's not correct. That's absolutely not correct. The mindset is that people are keen to refer to Johns Hopkins and all other universities out of Nigeria. Only yesterday, a group of researchers in Nigeria were received at Aso Rock by the Vice President on account of researches on COVID-19. In UNILAG, there are ongoing research by world-renowned virologists. But you see, the difference is that go and look at the research fund in Johns Hopkins University. Look at state commitment to the development of research. Look at town and gown synergy between industries. Research costs money and people pay for it. Who are those willing to pay for research in Nigeria? Look, at some point when government threw the challenge at our union, we told government that, look, universities are supposed to be think tank for society. These consultancies that you give to your friends and cronies, channel them to the university and pay for it. Up to today, not one. In UNILAG during the lockdown, we manufactured, a ventilator. It's still there in the laboratory. You require money to develop it. In Uniben, in Unijos, Nigerians are performing greatly in their choosing fields of endeavor. But serious societies support them. Even the money for researches in Nigeria come from outside. South Africa, America, England, etc. So
I have to just put you on hold because we have a caller who wants to contribute to this conversation. Hello, talk to us about what you make of our conversation today. Let's hear your view.
Yeah, good morning. Yeah, Mazi Okurapo is my name, calling from Arotuku in Asia. Dr. Dele. Good morning, my sister. You see, there are three things we have to look into this issue of resumption of Nigerian universities. One, I was expecting federal government and the state government will have private universities or polytechnic, college of education, health, at least to go and fumigate all these hostels and lecture rooms. And I was expecting the federal government at least to map out the strategy whereby not all the students will resume the same time. Maybe final year students and first year students.
Go ahead with your point.
So the point that I'm making is, if the Nigerian society wants the academia, the ivory tower, to contribute meaningfully to researches in our society about development, we must be willing to invest in education. As I speak with you, the bulk of grants that we use to do research in universities across Nigeria come from outside Nigeria. So unless government rejigs, its interest in the development of research in Nigerian universities, will continue to lament like this for a very long time to come.
But people continue to point fingers at the IGR. We know that there are several businesses within the four walls of the university. For example, some universities will have the staff school, some but that's secondary and primary. So all of this IGR, where does it go to?
Anyway, you see, thank you very much. This is a very good question, and I find it very exciting. Are universities established to make IGR? Do you hear about IGR in Johns Hopkins University? How much of IGR can you make to do research? And what is the IGR? Universities are selling pure water. The staff school is a demonstration school. It's meant to cater for the education of those who work in the university, and also as a laboratory for teachers, in the faculty of education. So really, they are not profit-making ventures. And IGR is a distraction in the university. Look, what is done in reasonable climes is that, take for example, an organization like
all right, again, I would have to put you on hold. Okay. We have another caller. Talk to us, we can hear you. All right, network challenges there. Please go ahead.
Okay. You have an organization, say like Mekano, operating in Nigeria, selling generators. Now, you fund researches in such a way that that kind of production can be domesticated. And then you get good money. Even government, you do consultancy, there's a problem. Like the COVID pandemic, for example, you assemble virologists from, say, about 6 universities, for example, 6, 7 universities. Give them ₦1 billion. That's how to run a university. That's how to do research. It's not to say that people who are selling pure water, selling bread, that's the kind of
Dr. Ashiru, there is no doubt that the budget for education in the country is not sufficient. There have been complaints and concerns in that regard. But are we saying that even just from the IGR, we cannot, the universities... I have told
you that there's nothing like IGR. Don't talk about IGR.
But are we saying that
you sell water, you sell pure water and bread? Is
Dr.
that what you...
Are we saying that these universities cannot provide, even just produce within the universities, nose mask, hand sanitizers? Is that what these universities cannot produce?
But they produce that. The simple chemistry student will produce sanitizers. But if you produce sanitizers, you need people to buy it. So, you see, the point to note is that there must be a synergy between university and society. such that, and look, it's not even the business of a university to produce all of those things. The business of a university is to think through it, provide the idea, and sell it, patent and sell. And then manufacturers or investors, entrepreneurs can then do the business of selling. A university is not cut out to be the one producing sanitizer and marketing it, producing nose masks. And these are not the kind of things that we're talking about. We're talking about ideas that can change society. Fundamental ones. Look at the IT industry now. You find competent, code writers who will just write a simple code and patent it and sell to solve myriads of solutions that may have been brought to his attention or that he might have seen in the society. So universities are citadels of ideas, citadels of innovation, creativity, which requires a lot of investment. In fact, look, you could spend several billions of dollars on a particular project before you can get result out of it. It is that result that will now begin to look at how much was committed to producing COVID-19 vaccines. And it didn't happen overnight. So any society who desires development, who wants research to grow the society, must be prepared to invest in education over a period of time. And it's not as you are doing it today, tomorrow, you are expecting results. You will do and do and do it until, you get, very credible results. So we should perish these ideas about universities having IGR and all that. Nigerian universities arrived at that point because of government's neglect. And go and do a random research in the universities. You will see all these things they call IGR. Selling pure water, selling bread, manufacturing sanitizers that nobody will buy. So those are not what universities are meant for. Universities are meant to think about social problems, economic problems, scientific, technological problems, profile solutions, and
absolutely.
then investors will take it from there.
So where are we now in terms of resumption? Where are we? Are universities looking to resume anytime soon?
Oh, sure. Take, for example, University of Lagos will be resuming on the 25th of January 2021. But we're resuming online. That's part of the innovation that I talk about. Now we have realized that it's almost impracticable to open the gates of the school for students. But also, they've been at home for ages. So how do we respond to that challenge? Now, we are moving, our instructions online on what we call the learning management system, which provides an opportunity for our students, wherever they may be, to log on to the LMS, and continue their education. That also has its own challenges. But we can't really fold our arms and say because we are bogged down by COVID-19 pandemic and then everything should be grounded. So those are the kind of things that we talk about. But all of these also require, infrastructure. You need Wi-Fi, you need, the LMS itself, you need training and retraining, not only of, the faculties, but also of the students on how to log onto the platform and get some learning.
All right, we'll see how all of these online learning and how other schools, federal universities are also picking up on this. ASU Chairman, University of Lagos, Dr. Dele Ashiru, thanks for talking to us.
Thank you very much for this opportunity. It's indeed a pleasure.
All right, and that's it on this morning on Thursday episode. Thanks for watching. I am Precious Amayo.